Stephanie.
Hi.
Good to see you again. I'm Erica, nurse practitioner student at Mass College of Pharmacy. Just going to wash my hands. Today I'm going to be doing a focus assessment on your neurological system. So first I'll be assessing your cranial nerve 1, which is your olfactory nerve. I'm going to have you close your eyes and occlude one nostril. And I'm going to have you let me know what you smell, okay?
Peanut butter.
Good. Now occlude the other nostril, keeping your eyes closed.
Coconut.
Yep. Good. Now you can open your eyes. Next I'll be assessing your cranial nerve number 2, which is your optic nerve. I'm going to have you hold the Snellen chart about 14 inches away. And I'm going to have you occlude one eye. Read the smallest line you can.
428365.
Great. Now occlude the other eye. And read the smallest line you can backwards.
563824.
Great. Great vision. Now I'm going to be testing the confrontation test to further assess your cranial nerve number 2. Actually, we'll bring these back. We're both going to include one eye. And you tell me when you see my hand come into the picture, okay?
Now.
Yep.
Now. Now. Now.
Great. Now on the other eye? Good.
Now. 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 Now.
Great. Okay, good job. Now I will be assessing your cranial nerves number 2 and 3, your optic and your oculomotor. I'm going to be checking your pupil response to light and accommodation. So first I'm going to have you stare over my shoulder. Test your pupils. Good. They both constricted equal bilaterally. Now I'm going to have you follow my finger as it comes into you. Good. Now I'm going to have you look at the wall behind me, and now back to my finger. Good. Excellent. Now I will be assessing your cranial nerves number 3, 4, and 6. 3 is your oculomotor, 4 is your trochlear, and 6 is your abducens. I will be, so I'm going to have you follow my finger laterally to the left, laterally to the right, vertically up, vertically down, to the right, up and down, to the left, up and down. Great, and that checks your extraocular eye movements. Next is your cranial nerve number 5, and I'm going to be assessing your motor and sensory function of that. First, I'll be assessing your sensory function, so I want you to close your eyes, and you tell me when you feel a light, or if it's a sharp or dull sensation.
Dull.
Good.
Sharp. Sharp. Dull.
Good. And again, to assess the cranial number 5, your trigeminal nerve, I'm going to palpate the masseter muscle and have you clench your teeth and open your jaw. Great. Next, I will be assessing your cranial nerves number 7 and 12. 7 is your facial, 12 is your hypoglossal. I'm going to have you puff out your cheeks. Good. Now smile and frown and stick out your tongue. Good. And then wrinkle your forehead and close your eyes shut. Good. And everything is equal bilaterally. No deficits are apparent. Next, I'm going to be assessing your cranial nerve number 8, which is your acoustic nerve. And I'm going to be standing behind you. I want you to block your right ear. I'm going to whisper something, and you tell me what you hear.
2. A. 7.
Good. And now again on the other side. Occlude your left ear.
12. 3. S.
Great. Next, I will be assessing your cranial nerves number, 9, 10, and 12. 9 is your glossopharyngeal, 10 is your vagus, and 12 is your hypoglossal. Here I will be looking in your mouth. So if you could open. Great. I can see your anterior posterior pillars, your posterior pharynx. I'm going to have you stick out your tongue and say ah.
Ah.
I see that your uvula is midline and that your tonsils are 1+, and no exudate, no swelling, redness. I'm going to have you swallow your spit to assess swallowing. Good. and have you say light, tight, ignite.
Light, tight, ignite.
Good. Very good. Lastly, I will be assessing your cranial nerve number 11, which is your spinal nerve. I'm going to have you lift your shoulders up against my resistance. Good. And I'm going to have you turn your head against my resistance. Good. And again, against my resistance. Good. So your cranial nerves are all apparently, intact, so everything looks good. Next, I'm going to be assessing your sensory function of your upper and lower extremities. So again, I'm going to use my little paper clip, and I'm going to lift up this. So I'm going to have you close your eyes and tell me if you feel light or dull. Sharp or dull, sorry.
Dull.
Yep.
Sharp. Sharp. Dull.
And then on the hands.
Sharp. Sharp.
Good.
Dull. Or dull.
Good. Excellent. Now on your lower extremities and then your feet, I'm just going to roll these up. Thank you. And take off your socks. Good. Oh, sorry. Ready? Yep, close your eyes.
Dull. 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 Sharp.
Good.
Sharp. 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 Dull.
Good. And then on the feet.
Dull. Dull. Sharp. Sharp.
Sorry.
Sharp. Sharp.
Good. I'm going to put your socks back on.
Thank you. You can do it.
Next, I'm going to be assessing your vibratory sensation. First, let me get my tuning fork out. First on your, thank you. So you're going to tell me when you stop feeling the vibration.
Now.
Good.
Now.
Great. Now on your ankles. Let's see.
Now.
Good.
Now.
Good. And on your great toe.
Now. Now.
Okay, good. Now I will be assessing your stereognosis and your graphesthesia. First, stereognosis, I'm going to have you close your eyes, and I'm going to place an object in your hand, and you're going to tell me what it is.
Tissue.
Yep, good. Keep your eyes closed. I'm going to put another object in your hand.
Orange.
Very good. Now to test graphesthesia, I'm going to draw something in your hand, and with your eyes closed, you tell me what it is.
2.
Good.
11.
Great. All right, so next I will be assessing your fine motor skills of your upper and lower extremities. First, your upper. I'm going to have you put your hand out in front of you and touch at your nose and with the other hand. And now do it more rapidly. And then close your eyes. Excellent. Good. Now you can stop and put your finger to your nose, and I'm going to have you touch my finger in different spots. Great. Now with the other hand. Excellent. Now I'm going to have you touch your thumb to each finger, and then backwards, and then faster. Great. Now put your hands palm down, and then palm up, and then quickly. Excellent. Now to test the fine motor skills of your lower extremities, I'm going to have you lay on the couch.
Okay.
Great. And I'm going to have you put your heel to the top of your shin right here, and then drag it down. Excellent. And then the same thing with the other. Good. Now I'm going to bend your toe back or forth. You tell me which one, which it is, back or forth.
Back.
Good.
Forth. Forth. Back.
Excellent. Now if you could just sit up on the side, I'm going to have you do some toe tapping.
Okay.
So tap both feet on the ground and then together. Excellent. Now if you don't mind sitting back here, I'm going to assess your deep tendon reflexes. All right. First I'll do the brachioradialis. Thank you. So hold your thumb and about 2-3 centimeters above. Good. loose. Good.
Mhm.
Good. And then your biceps. So I'll hold right at the biceps tendon. Good. Great. Now I'll assess your tricep reflex. So just dangle it. Great. And then again. Excellent. And then your knees, so just dangle your knees. Great. All right. And then lastly is your ankles. So I'll hold them in flex position. Great. Okay. So all your reflexes are equal bilaterally and about 1 to 2 plus, which is perfectly normal. Lastly, I'm going to be assessing the Romberg test. So I'm going to have you stand up. I'm going to have you close your eyes and stand there and assess for any swaying or movement. Very minimal. So for about 20 seconds, I'll observe you. Looks great. Now I'm going to have you keep your eyes closed and actually open them so you can see what I'm doing. And lift your arms up. Now close your eyes. And again, for about 20 seconds, I'll observe you and look for pronator drift downwards, which I don't see. Okay, great. Now I am going to have you walk on your heels. And good. Now turn around and walk on your toes. Excellent. Now walk heel to toe. Heel to toe. Great. Okay, then I'm going to have you stand on one foot. Balance. Good. And stand on the other. Balance. Good. And now hop on one foot. And then again on the other. Good. And then I'm going to have you do some deep knee bends. So hold, yep, good. Put your leg up and then bend. And then the other arm. Leg. All right. Excellent. Well, your everything looks intact. So congratulations. Good to see you again.
You too.
I'll see you soon.
Okay.